The Quezon City government raises its COVID-19 alert level status to yellow. That comes after recording an average of 26 cases per day this week. On Saturday, the health department says 14 out of 17 areas in Metro Manila recorded a slight increase in COVID-19 cases. And we now talk to the OCTA research group. Joining us live via Zoom is research fellow Dr. Guido. Good morning, Professor David. Thank you so much for joining us. So as you heard, Quezon City there now on yellow alert status. Is this a cause for concern at this point in time?
Ria, it's not a cause for alarm yet, but it's becoming a cause for concern. What we want to highlight is that, at this point in time, the situation in Metro Manila is still at low risk, but it may be moving up to moderate risk by around next week, in 1 to 2 weeks. So the reproduction numbers already increased to 1.49 in the NCR, and the 7-day average in cases has increased from 88 to 115. So we're now averaging more than 100 cases per day in Metro Manila. Again, 115 cases per day is still not that high at this time, but the trend is that it is increasing, and the increase is starting to, the acceleration is starting to also increase each week.
All right, for Quezon City and I guess other cities in the metro, what do they need to do to prevent a surge in cases?
Well, to be fair, like I said, the increase is still slow at this time. But to prevent further increase in cases, we should really call on people to follow minimum public health standards. So we're not anticipating a surge just like what happened in January, for example. Be that as it may, there will still be people who will be getting COVID, and people say it's mild, but getting hospitalized, people getting COVID will still be disruptive, and it still costs money for people in general. So we really encourage people, the public, to practice minimum public health standards. Wear face masks, and maybe especially for the vulnerable, to lessen their movements, so that they could avoid getting COVID.
Right. Certainly not a time to let our guard down. So talk to us about the status right now, Professor. Where are we exactly, and what is the reproductive rate again, please?
Right. So just to run down some of the numbers that we're seeing, as I mentioned, the 7-day average in cases has increased from 88 to 115. So that is actually a 31% increase in cases. And previously it was a 19% increase, and now has increased to 31%. That's a growth rate. The reproduction number is 1.49 from 1.21 previously in NCR. The positivity rate is 2.4% from 1.5%. So the positivity rate for testing is also going up. Healthcare utilization increased slightly from 21 to 23%. So this is still very low, but again, usually cases start to increase first before hospitalizations. And finally, the ADAR, our average daily attack rate, is 0.81, but it's slowly going up, and it might be more than 1 sometime next week, which means that from low risk, we might be moving up to moderate risk by next week.
Right, Professor, we've been talking a lot about Quezon City, but what are the other areas experiencing a rise in cases, and do you classify these increases as significant?
Well, even in other parts of Metro Manila, for example, Parañaque and Makati have been seeing sort of higher numbers than before. The increase has not been that large yet at this time, but again, it's the trend. It's the pattern that we're seeing upticks every week. In fact, we have been seeing an increase in cases for 4 weeks now, since early May. And what this means is that it's not yet stopping or slowing down. So it's a slow rate of increase, but if it continues, like we mentioned, we could be having higher numbers next week. I mean, I remember, I think we talked maybe a week or two ago, and I've been saying that, we're still monitoring it, and now we're monitoring it, and now we're seeing that it's moving from the, no, something not to be concerned to something to be slightly concerned, and now it might be something that would be more of more serious concern sometime in the near future.
All right. So numbers are increasing, albeit slowly. When do you predict the peak of this increase will be, Professor?
Well, right now, Ria, it's hard to say when the peak would be because it could be still just accelerating. So it would also depend on how the public responds. If we, practice minimum public health standards, if we get vaccinated, if we get booster shots, we may be able to slow this down significantly. It may be just going up for, right now, we could say it could go up for a few more weeks and then start to decrease. So in Metro Manila right now, as I mentioned, we're averaging about 100 cases per day. And the trajectory right now points to about somewhere like 300 to 400 cases per day by the end of June if it continues to hold.
All right. Thank you so much for your time. As always, OCTA Research Fellow Dr. Guido David.